Well, hello everybody. I'm Kearney, the Assistant Minister for Health and Aged Care. Thank you for inviting me to speak to you today. Chronic pain is a topic that is very close to my heart, so I am really sorry I can't be there in person with you for this important conversation. I acknowledge the traditional owners of the land on which I'm recording this message, and I pay my respects to elders past and present, and I extend that respect to First Nations people there with you today. This week, National Pain Week, is an important one. It's important because having a national week for pain raises visibility on an often hidden condition. It helps push forward a much needed national conversation because chronic pain is invisible in so many ways. For the 3.6 million Australians living with chronic pain, their suffering often cannot be seen by naked eye. It's invisible to those they pass on the streets, and even sometimes to their loved ones. The hours and hours of unrecognised labour by carers are also often unseen. The broader public do not understand that this pain can be severe enough to restrict the activities in day-to-day lives of people living with chronic pain. Their attendance at social events, at family birthdays, playing sport, going to work. And what's more is the toll that all this can take on people's mental health, causing depression and anxiety. Nearly 3/4 of people living with chronic pain feel ignored or dismissed when raising their pain with health professionals. Many feel powerless. Others feel dehumanised. And there's also a hidden economic cost, both to the healthcare system and the loss in productivity. I think part of the reason why pain is so often misunderstood is because of Australia's masculine-leaning battler mentality. All too often we're told to just push ahead, to suck it up, just get on with it. Now this approach is just wrong. I know that everyone here today knows this, but for the rest of us it's an important lesson that we as a country need to learn. So it's great that we have National Pain Week, because this week raises awareness about the resources available for people living with chronic pain, the support mechanisms for carers, and through all of this brings a spotlight on how we view and speak about pain. It will mean we can make a dent in figures that tell us that nearly half of those people living with chronic pain take longer than 3 years to get a diagnosis, or that 1 in 10 are still undiagnosed. I want to sincerely thank everyone at Chronic Pain Australia for everything you do in education, in awareness, in support, and in building community. You are leading the change. The Albanese Labor government recognises the significant impact chronic conditions such as chronic pain have on Australians, and we support your mission. It's why we fund the National Strategic Action Plan for Pain Management, which is about addressing effective care and management for people living with chronic pain. It's a whole-of-care approach with a focus on supporting self-management. As Assistant Minister for Health, I'm particularly proud of the work that we're doing in women's health and addressing women's pain. For too long, women's health has been dismissed, ignored and overlooked. And last year, I launched a national survey on women's experience of discrimination in the health system. The results, while shocking, were sadly not surprising. 2 in 3 women who responded have experienced gender bias in the health system. Women told us they're not being listened to, and when they are being listened to, they're not being given the proper care. Too often they're told again to just suck it up. That's just a woman's lot. It's not surprising then that 1 in 5 women with chronic pain felt stigmatised by their spouse or life partner. Now, I'm working with my Women's Health Advisory Council to address these findings, and we will have more to say on this soon. But one initiative I did want to highlight is the Albanese Labor government's specialist endometriosis and pelvic pain clinics. We've invested over $50 million to set up 22 dedicated specialist clinics around the country. They offer multidisciplinary care for women, a place where they can finally be listened to and have their pain treated by empathetic professionals. I've spoken with so many women who have told me just how life-changing these clinics have been for them. So as we mark National Pain Week, I want to again commend Chronic Pain Australia for its work and for coordinating the week each year. In advocating to reduce the social and economic barriers to those who live with chronic pain, you and your committed volunteers are the national voice, and I want to assure you that we are listening to that voice. Working with you, I trust we can make real improvements for the 3.6 million Australians living with chronic pain. Thank you.